Okay, if I were going to talk to someone about bowel and bladder function and help them if they were having problems, I would try and guide them into some different advice for positions to be sitting on the toilet, first of all. I would encourage them to be in um, a relaxed, private place when they were trying to urinate or defecate, and for men, I would encourage them to be in a seated position if they were having trouble trying to urinate, like completely. So, if they were having trouble urinating completely, there are a couple things that they could do. You could try to rock back and forth, lean forward while on the toilet, or try techniques like double voiding, which is once you've stopped voiding, stand up, sit back down, lean forward, and try again. Then they could also try relaxing before voiding by exhaling, like blowing through a straw, and then try to void. If they were having a hard time relaxing enough to urinate, another thing that they could do would be to place your hands in warm water, listen to running water while they were trying to urinate, or pour water over their groin. As far as incontinence goes, using a bladder diary, like we've talked about, we could give them the form to do it, encourage them to fill it out for a few days, and then we could work that information that they provided us into bladder training. So bladder training would be controlling urinary or controlling urgency and frequency by urinating on a schedule. So what we'd want to do is take you on a schedule and increase the time between urination gradually each week. So we find out what goes on with your bladder diary and what your normal times are in between, and then we set you up on a schedule, and you have to urinate on that set schedule, and we'll try to increase the time in between every week. Things that you can do to control the feeling of urgency while trying to do this urination on a schedule would be focused deep breathing. When you feel the urge to go, you want to try and focus on your breath instead of the urge to urinate. And also trying techniques like quick flicks of the pelvic floor musculature. So trying to do like squeezing Kegel exercises, a couple short ones at a time, or even one long squeeze, seated with your thighs together. Try and squeeze the pelvic floor like you're trying to stop urination. Hold it for as long as you can with your knees together. Another thing would be to distract yourself with activities that require thought. So not like watching TV or talking on the phone, but actually thinking processes like word games or puzzles or something that really requires you to use your brain. Another thing you could do would be positive self-talk, like I'm the boss, I am in control, I can beat this. When you're having the urge to go, talk yourself through it in order to get to that next time when you're to stay on schedule with your bladder diet or with your bladder training. Practicing contracting the pelvic floor muscles at times when urine leakage is most likely to occur is also really important. So a second before you feel like you've got a sneeze coming on or a cough coming on, before you go to stand up, or when you start to bend over, anything that you feel like causes you to leak urine, you're going to want to try and contract the pelvic floor before those activities and then go and do them. Other interventions that we could talk about for strengthening the pelvic floor would be Kegel exercises, like I mentioned earlier, but doing these Kegel exercises in all different positions and throughout the day. I would try and guide them while in my office with what a proper Kegel exercise was with biofeedback. I also found online that there's a thing called the Myself Trainer, which is like a take-home biofeedback device, or even, I guess, the same thing that you'd have in the office, but it is available for them to purchase for, I saw it for $150. So I might encourage them to try and take that home and really practice with it. There were also vaginal weights on the internet. They were about $40. I came across and did a critique on the wellness program that was actually recommended by one of you guys, for the Total Control program that's put out by the Women's Health Foundation. That's absolutely wonderful. It looks awesome. So giving them the resources for finding the things that they would need to train at home with Kegel exercises, and other things that I thought were beneficial on the Women's Health Foundation website that were resources were things like cleansing instructions for people that were having leakage and getting infections from it, and also skin protectant lubricants that would help the skin and prevent infection if someone's wearing diapers or pads and they're leaking all day. I didn't even think of that being an issue, and I thought that was really a good thing to know about. If they were experiencing edema in their feet and legs, I thought it was interesting. Like during the day, I would encourage them to try and lie on their left side for a couple hours in the afternoon or early evening, and during the day, like after lunch or when they were watching TV, to prop their legs up on a pillow, get them to above the heart height in the afternoon or during the day. And then also the use of support stockings if the edema is that bad. Evidently, if they're going throughout the day and their legs have edema, then at night they're going to have their kidneys be processing all that extra fluid when it's trying to filter out. And so management of edema is seeming to be important. As far as lifestyle changes regarding nutrition, caffeine is a strong diuretic, so they'd want to avoid caffeine. There was a website that I found that was, let me get it here, seekwellness.com, that had some really cool handouts that you could give to people about like the caffeine counting list, and it spelled out how much caffeine was in different beverages and foods. So having them understand that caffeine is a strong diuretic and dehydrator is important. Also, avoiding acidic foods like citrus fruits and citrus juices, teas and coffees are also very acidic, tomato juice, all of the high acidity things, even cranberry juice, which a lot of people think is good for their bladder, the high acidity can be an irritator to an overactive bladder. So you want to be careful with acidic foods, milk or milk products, carbonated sodas. Any fizzy drinks can irritate the bladder and cause the urge to urinate more often. Foods that are spicy or foods that are sweet, anything sweet, even artificial sweeteners like equalin, sucralose, and all those things, sugar, corn syrup, all that can be irritants to the bladder. Alcoholic beverages can make you urinate more often. And also keeping healthy bowel habits, taking probiotics, increasing fiber in their diet with fresh fruits and vegetables, whole grain breads, sprouted grains, getting enough exercise. If someone's having trouble with constipation, you want to make sure their bowel movements are more regular with all of these things, because if they're trying to defecate and they're squeezing all the time, and what's the word? They're not squeezing, but straining, that puts a lot more pressure on the pelvic floor and the bladder as well. So I would encourage them to get enough fiber in their diet so they're not straining when they're trying to defecate. Doing exercise like abdominal twists in yoga positions, giving them some resources on that, getting enough cardiovascular exercise, walking at nighttime, just trying to encourage them to keep healthy bowel movement going. Also, maintaining a healthy weight is important, because as they gain weight, that adds pressure to the pelvic floor and everything gets having too much pressure to function properly. As far as hydration goes, it's important for them to be hydrated, but not overhydrated so that they have to go to the bathroom all the time. So to monitor the color of their urine, notice whether it's clear to straw-colored urine, and don't drink water 3 to 4 hours before their bedtime if they're having a problem with nighttime incontinence. Concentrating on fluid intake in the morning and in the afternoon, and then not having fluids after 6 p.m. would be a general rule that they could try and follow if they were having trouble with nighttime incontinence. Stopping smoking. Nicotine is evidently a bladder irritant that causes bladder contractions and the sense of urgency. So smokers also, besides that, have a cough a lot of the time, so that chronic coughing can cause leakage as well. Over-the-counter medications that they may not be aware of that are bladder irritants are Excedrin, Midol, Anacin, Dristan, and Sinarest. So if they're taking any of those regularly, I don't know if Dristan and Sinarest are actually over the counter. They may be prescription, but you want to encourage them to be aware that they could be taking medications that could stimulate this as well. I think the only thing that I forgot that I wanted to talk about was when trying to defecate, the position that we've talked about in classes, spreading the knees open, bending forward with their elbows on their knees, and doing a posterior pelvic tilt, so having them rock back at the same time, and even rocking back and forth. Those are all the things that I would try and encourage my patient to do, and I would try and give them some of those website resources that I mentioned, and I think that that would be my spiel.